If you're a man with inflammatory bowel disease, you may be having problems with erectile dysfunction. In this video, we're going to discuss why that is. Impotence or erectile dysfunction is common in men who have inflammatory bowel disease. It occurs in about 1 in 4 men who suffer the condition, and it's prevalent in men who are under 40 who would otherwise be at low risk of having this problem. Active inflammatory bowel disease can cause the complication of impotence because inflammation, particularly that in the pelvis, can irritate the nerves and blood supply that power an erection. Secondly, there's an overlap between inflammatory bowel disease, impotence, and depression. Any chronic disease can cause depression because it's difficult to live with. In the case of inflammatory bowel disease, it can be especially troubling because it can be difficult to be confident in bed when you're worried about things like urgency, which might disrupt romance. Selective serotonin reuptake inhibitors are commonly prescribed to help people deal with depression and anxiety. These medications have the unfortunate side effect that they can further complicate an erection. So the doctor that is prescribing these medications may want to consider if there's a different medication that might have the positive effects of improving mood without disrupting the ability to get an erection. Opiates and related medications that may be prescribed to help a patient with the pain of inflammatory bowel disease may also have side effects of causing erectile dysfunction. And for this reason, I encourage patients to minimize their use of opiates and focus on other disease-modifying medications that can actually control the inflammation and therefore deliver better control of pain. Opiates, unfortunately, really only treat the symptom of pain without getting to the underlying reason. Another risk of erectile dysfunction for patients with inflammatory bowel disease is surgery, especially surgeries that are low in the pelvis and take place in the area of the pudendal nerve or the blood vessels that feed the penis. Because of this risk for impotence, I encourage patients with inflammatory bowel disease who require surgery to seek a colorectal surgeon. These surgeons have specialized training to deal with these operations that take place low in the abdomen and pelvis and are used to the difficulties of managing tissues that are inflamed and angry. A general surgeon can be critical in an emergency situation for a patient with an inflammatory bowel disease who has a perforation, but when a patient has the time to decide who visits their neighborhood, I recommend they invite a colorectal surgeon. If you have erectile dysfunction in inflammatory bowel disease, talk about it with your GI doctor. While we don't specifically treat this symptom, it's important for us to know about because it's a marker of active inflammation, and we can point you to a doctor who may be able to better help you. There can be stigma around a lot of the symptoms that make inflammatory bowel disease difficult to deal with. And so I encourage you to subscribe to this channel so we can continue to discuss some of those complicating symptoms and how to engage your GI doctor in your inflammatory bowel disease care. Thank you for your time and be safe.